afternoon. I don't know, wherever you are, it depends. I'd just like to introduce myself, and I am Tanya Price. I'm a Karyopharm nurse liaison. And what that is a Karyopharm nurse liaison actually supports the sales team to provide education to healthcare providers and to patient support groups. I am joined today by my colleague, Brenda, and she's going to present to you the information on KaryForward. So I'm just going to give you a brief overview of what XPOVIO is, how it works, and how it's now indicated. I will be happy to answer questions for you at the end of this presentation. If you would, please just hold them to the end. I also need to provide the disclaimer that I am here to provide you with XPOVIO education and support, and that I cannot give you medical advice, and all of your medical advice and decision-making should be made within your own healthcare team. So at that time, I'm going to pull up a slide to show you how Selinexor works. Just give me 1 second here. Oh dear, where did it go?
I think it's so funny. We test and this always happens. So it's not just you, Tanya.
Oh, there it is. Now I see it. Thank you.
Awesome.
Sorry. Thank you for your patience.
No problem.
So this is actually how XPOVIO works. So XPOVIO is a medicine that's used to treat multiple myeloma patients at their first relapse. So that means if you have been treated for multiple myeloma and it comes back, your doctor may prescribe XPOVIO for you. Our current indication, or how doctors are prescribing it currently, is in a triplet combination form. So XPOVIO along with Velcade or bortezomib, however you may know it, and dexamethasone. So it is now a triplet combination. You may be familiar with our prior approval in which it was just used XPOVIO and Selinexor. But now we can use it in a more powerful combination, and we can use it earlier in your treatment journey. So XPOVIO works by actually restoring the body's own tumor cancer defense mechanisms. So in malignancies, there is this overproduction of what we call XPO1, and this is a protein that carries other proteins back and forth from the nucleus to the cytoplasm. And this is a very delicate balance. In malignancies, we have an overproduction of these XPO1 nuclear transports. And when you have too many of them, they're going into the nucleus and taking too much out of the nucleus and putting it into the cytoplasm. And one of the things that it carries is what we call tumor suppressor proteins. And when they're in the nucleus, they're able to tell the cell if it's a healthy cell or if there's a defect or a malignancy, or if it discovers it's a myeloma cell. And what it does then is it pushes it into what we call apoptosis, or a programmed cell death. So it basically kills off the defected cells. XPOVIO works by blocking those extra XPO1s that are expressed in malignancy and putting that cell back into balance, trapping those tumor suppressor proteins inside the nucleus where they can actively work, and then able to push your cells into cell death. If you would like to learn more about XPOVIO or the way it works, how it's indicated, what side effects and monitoring occur with the use of XPOVIO, we have a Karyopharm nurse liaison team that crosses the entire country, and Audrey can help. We are available upon request. Audrey will help you to facilitate that process. And at this time, I have one more slide to share with you. So let me stop sharing this one and give you my next one. 1 second here, guys, sorry. And hopefully you can now see this. Okay. So we have this XPOVIO or Selinexor patient starter kit that has been designed for patients that are on their XPOVIO journey. It comes in a nice little blue zippered bag where you can put all of the contents inside. And it even has a welcome to your starter kit as well as a caregiver brochure, because we believe in really supporting your caregivers on your journey as well, because we know that's also a tough job. We included inside of here is this nice cookbook, Eating Well Through Cancer, and a calendar so you can track your treatment schedule as well as side effects. Now, Brenda, I'm going to pass it over to her, and she is going to tell you all about this KaryForward program that we have available for you and all of the benefits it has. It is really great. So, Brenda, with that, I'll turn it over to you.
Thank you, Tanya, and thank you, Audrey, as well. I appreciate it. I was just curious because I know some of you are currently on XPOVIO. Have you had the opportunity to get a starter kit through your pharmacy or your physician's office? You can either nod your head, shake a little, raise your hand. Okay. All right. So we'll talk about that a little bit later. I think there's some follow-up that we can do if you are interested in a starter kit. So we can talk about that too if it's something that you want. But as Audrey had mentioned, I'm Brenda Fabish, and I'm here to talk a little bit today about our KaryForward program and the opportunities that we have to support you. As Tanya mentioned, I should also state that this is for informational and educational purposes only. So specifically looking at your insurance coverage and benefits would be something that you should do for yourself. All right, I'm going to try to use a website. Hopefully that will help you guys, because I want you guys to also be able to see where you can go if you're interested in learning more about KaryForward and the support that we can offer you guys. All right, so this is the website. It's actually KaryForward.com, and it is specifically for patients and caregivers, so there is a nice tab for that. And it talks about the different opportunities that we have to support you in your journey. Some of it can be around insurance coverage, financial assistance, other support and resources that we have, and then also some helpful organizations that you might also want to link to if you haven't already done so as part of your journey. So I'm sure a lot of you are well versed in the insurance world now, probably not more than you ever wanted to be, right? Really getting involved in your own advocacy and care and making sure that you can get appropriate coverage for your medications and your doctor's visits. But I do want to spend a couple of minutes just kind of talking about the different types of insurances that are out there so that we're all on the same page. And I also want to mention that I'm going to be very careful to try to not use a lot of acronyms today, but it's kind of how I talk. So if you happen to have any questions around something that I've said, please go ahead and either put it in the chat or you can ask while we're having a conversation. So I appreciate that. So I want to talk about the different insurances that are available. I'm going to start with the government programs and some of them that you guys might already be enrolled in. Medicaid being one of those, which is a government program run by the state or administered by the state. And that program is for individuals who have a lower income. There is also another insurance that is run by the government, which is called Medicare. I'm sure several of you have heard of it. And it is an insurance program which has 4 different buckets involved in Medicare. So there is Medicare Part A, which is covering your hospital stays and hospital visits. Then there is the Part B, which covers your medical drugs that you might receive within the office or your office visits and office costs. Then you have Medicare Part C, which is actually run by private insurance companies, but it is a combination of your A and your B together. And then sometimes it also has the prescription benefit as well, which is called Medicare Part D. XPOVIO, because it is an oral medication, would be covered under the prescription benefit, which is Part D. And it's important to note that, and I'm sure you guys are aware, that every year there is an open enrollment process. So every year, and this year it happens to be October 15th to December 7th, you guys would have the opportunity to go in and take a look at the current coverage that you have, maybe make some decisions if you wanted to adjust that, and just reevaluate if there's that opportunity for you to change insurance at that time that might cover some of the current situation that you guys are in. So when we specifically talk about KaryForward, KaryForward has the opportunity also to talk about your insurance coverage with you. Maybe you have questions on whether your insurance would cover XPOVIO, or you have questions about understanding something that you've received back from the insurance company. So if you have questions, you can always reach out to us using our 1-800 number, and we can start that process of enrolling you in the program and trying to help you with any of those kinds of needs that you might have. It's very possible that if you are currently on XPOVIO, that your specialty pharmacy or your individual pharmacy that is giving you your XPOVIO and dispensing it to you has already done a lot of that work. But sometimes there's extra questions, or maybe you're wondering if there might be another insurance that you can enroll in. Maybe if you have Medicare, you might want to enroll in Medicaid if you are eligible. So there's lots of different scenarios in which we might be useful to you when you're looking at your insurance coverage. All right, I'm going to switch back here because I want to go also then to some of the other benefits that we have. We also have financial assistance. So as I mentioned earlier, there are different types of insurance. So there is Medicare, Medicaid. I forgot to also mention that there is commercial insurance, which is insurance that you would probably receive from your employer, or it might be part of a retirement benefit that you would receive from your employer. And so this program goes hand in hand with a commercially insured patient. So I'm going to go into this program and show you specifically how you can enroll and how you may be able to receive your XPOVIO for as little as $5. So it's a pretty simple process where you would go in and you would click the Begin Enrollment tab. You would go in and put in your information, which is specific to you, your name, date of birth, address, etc. You would click Agree, and then you would click Next.
Brenda, I just wanted to interrupt real fast. They can't see the tab you're sharing now. So if you want to, no, it's okay. It says switch to this tab at like the kind of the top. It says switch to this tab.
Okay.
You can see that. If you click that button, we should be able to see your new tab.
I didn't do that before. That's interesting. All right. Is that better?
Oh, no. I think you clicked stop presenting. It's okay. We can jump back on.
Those darn Google things.
I know.
Okay, well, let's try it again. I always feel bad when I can't hear anybody either. So it's like when you're talking to yourself.
I know. No,
Can you see it now?
We can see the
financial assistance, right?
And
then if I click on this page, then I do share this tab instead.
Yes, perfect.
There you go.
Mm-hmm.
And then, as I mentioned, you click here for the Begin Enrollment. And then you can see this piece as well.
Yes.
Okay. So this is where you would fill out that information, as I had mentioned earlier. And then you just click Agree. On the next tab, which I can't click on because I'd have to take the time to fill all this in, there's just 5 questions that you would answer about whether or not you are a U.S. or a U.S. territory resident, if you do truly have commercial insurance, a valid prescription for XPOVIO, that you're not eligible for other programs such as Medicare, Medicaid, TRICARE, and that you're not a cash-paying patient. And what happens then is it does actually give you a card with a specific number on it that you can take to your physician, or you could take to your pharmacy, and they can enroll you in the program and allow you to get the product for as little as $5. Now, I want to see everyone because I hope that each of you are able, if you have commercial insurance, to get your drug for $5 now. Some different pharmacies, depending on whether or not you're enrolling or not, and I see Bob shaking his head, so that's good because I want to ask Bob specifically about what he's shaking his head about. They may think, well, $25 is okay, or $50 is okay. And that's why we're here today, right? Is so that you guys know that if you have commercial insurance, that there is this program out there by Karyopharm, and that you do have this opportunity to enroll, even if we are proactively doing it for ourselves, rather than having the physician or the pharmacy do it for us. So Bob, do you want to come off of mute? Because I see you shaking your head. Oh, I lost Bob. Oh, now I see Bob. Whoa, hi, Bob. Good news, you're not driving, Bob.
Click the microphone button, Bob. There's a little mic button at the bottom. There you go.
How about that?
Great.
Perfect.
Well, good morning to all of you, and thank you for doing this for us. Usually the first prescription in the year goes all towards the donut hole, and my first prescription was a lot of money, and then after that, because I filled up the donut hole, then it dropped down to $7 per prescription. But the initial one at the beginning of the year is significantly higher than that. Let's put it that way.
So you were on XPOVIO when that happened?
Yes.
Okay. And so that I'm really glad that you're bringing it up, Bob, because it really is Medicare, right? So Medicare does have the donut hole in the Part D, and that is definitely an area where the copay card does not apply because it's a commercial insurance program. But pharmacies, as well as our KaryForward services, would be able to work with you in the future to look at foundations that are available. So there are different foundations available to support you in that journey.
Well, that really sounds good, but you have to have such a low annual income. You'd be starving to death anyway.
So and I'm so glad you're bringing that up too, Bob, because every program is slightly different, but we do know that there are some income requirements, right? And we do know that that happens with foundation support. So in the future, if that does happen still, I would love for you to talk to your doctor and talk about enrolling in our KaryForward services, so we could at least look at it on our end too and see what we could do to help you. Because there are...
Well, excuse me, go ahead.
No, please, go ahead.
Talking to my doctor, he's prescribing this stuff. He doesn't know the intricacies of paying for it.
Right. So we'll talk about, even when we're done here today, how you can download an enrollment form, or how we can help you get that enrollment form in front of the doctor. And really what the form does, it also just gives you permission to talk to our third-party program, so to talk to KaryForward, because you're right, sometimes doctors are not fully aware. And so I want you to know that we at Karyopharm, we care about every patient, and we want to make sure that we can help you in every way that we can. And so if there is that situation where there is that donut hole issue, or there is a high cost, we want to at least see if we can have that conversation and see if we can help support you, because we do have programs available too. And we'll talk about that. Actually, we can do it right now. We'll talk about it. I'm going to try to switch over again.
when they hit you with that first bill at the beginning of the year, it's shocking.
Yes. Yes, absolutely. And we understand that. And so I think foundation support, and it's very different, it varies by program, but there is a limit, right? There is an FPL percentage. So we do know that too. So, but we have other support programs, and that's where we talk about it here, which is called our patient assistance program. So if, let's say, you are considered to not have insurance, or you have a lack of coverage, which is what I would consider, being in the donut hole where there is that higher expense, we also may have the opportunity to offer the product to you at no cost, depending on if you're eligible for the program. So I always encourage people, because I know you guys have been through a lot, and this has been a big journey for each of you, that we don't know unless we ask. And so I really encourage you to ask us, and if we can help, we definitely will. Okay.
Thank you.
So I do appreciate you bringing it up. I know that does come up a lot with Medicare patients. So thank you for sharing. So yes, that is our patient assistance that we also offer. And now I'm switching tabs again to move back and forth. And I want to talk about another resource that we have. And this is one that I think we've had the opportunity also to talk to Audrey about. And this is our nurse case manager program. A lot of different pharmaceutical companies have these types of programs. I don't know if any of you have been able to take advantage of these programs in the past, but it is another resource that is available to those individuals who are on XPOVIO. And it is a single point of contact. You have your own specific nurse case manager that would work with you, and they really would help walk you through the journey to understand your prescription, maybe how to take the medication, side effects that you might encounter while you're on the product and how to manage that, but really also how to manage that conversation with the doctor. And it was interesting because I was listening to the video right before, and they were talking about that too. You being the advocate, right? You being able to know the questions that you want to ask when you're in front of the doctor. And this is also one of those resources that could help with that. It is a program that you would sign up through our enrollment form program, very similar to what we're going to talk about with the other resources, but it just kind of layers on top of the support that you're already getting from your doctor and from the doctor's office. So I'm going to ask and see if I can see everyone, but have any of you ever taken advantage of these nursing support programs from other drugs that you have been on?
No.
Okay. And I don't see everyone else, but if anyone wants to even pop off of mute, if you've used it with any other product or have seen these to be valuable. No? Okay. I don't see everyone, but I'm going to go with no. Audrey, if you see a yes, let me know. Do you think it's something that would be valuable to you if you knew that it had existed? It's something that if you were told you were going to go on XPOVIO, you would have that opportunity to get some of that support?
Yes.
Great. Great. So again, I'm not sure where each of you are in your journey, but I do want you to know that this program does exist. You can enroll in it now. You can enroll, in the future, but it is something that we can help get you started with, either by calling the 1-800 number or another way that I'm going to show you in just a couple of minutes. I appreciate the feedback, you guys. Thank you. All right. So
can I interject something here, Brenda?
Of course.
In my case, and I don't know about anybody else, but in my case, a doctor prescribes medication for you, and so I typically ask what side effects are, and how do I handle these things, and what if this comes up, and those are typically my questions. It's never about what is available to me from a financial standpoint and also from an accessibility standpoint. And that is never part of the conversation with the doctor. And the doctors basically say, well, this is what you should be taking, and these are the reasons why. And they're very good at explaining the medication, but they don't know the intricacies of working through your company or any other company. I've been on 6 different lines of medication, and none of them have ever offered me an opportunity to take advantage of number 1, education, number 2, financial assistance. So how can you or your company, how can you incorporate that in to the doctor's presentation so that we know that's available to us?
And this is just my opinion, and Audrey, you can add in if you like, but depending on where you're getting your treatment, some of the practices do have what are called financial navigators or financial counselors. And so that is a question to ask. Do you have that type of a support person that I could talk to about the programs that might be available to me? So that's one thing that I would advocate for in asking that question. And many times maybe the nurses would have more of an understanding of what the support might be that is out there. And then I'm going to refer it back to Audrey because she might have some other ideas.
I just think the biggest thing that we can do is patient advocacy. And as much as I, respect the doctors and the pharmaceutical companies, a lot of what they're doing is caught up in red tape and bureaucracy and things like that. And the way that we're going to make the biggest changes through our patient advocacy and saying, I would really like it, doctor, if you told me about financial resources that are available to me, or just kind of, hey, doctor, I think posting need financial help, talk to our advisor, would be useful to have around this clinic. It's going to come from us. It's going to come from us pushing and pushing and pushing until it becomes the norm. Because I think the doctors are caught up in the science of it all and making sure they see all their patients, and the pharmaceutical companies are trying and getting caught up in the restrictions that there are. And I think, as Jenny has mentioned to us, Jenny's the founder of Myeloma Crowd by HealthTree, and the biggest way that we're going to make a change is through patient advocacy. So I know it's not the answer we want to hear, but the answer is you got to do it, Bob, and I know you can because you're awesome.
I hear exactly what you're saying, and I'm a kind of guy that probes, and because I want answers, but the problem is I don't know what I don't know.
Exactly, and you're coming to this session to learn more, so it's just little moments like this where, okay, I'm educating myself to know what I don't know. It's not an easy answer. Tanya, did you have something to add?
There's a couple more people within the office that could be helpful in discovering these programs. And those people would be either a social worker, if you have a physician's office that has a social worker that's working with them, or if they have a nurse navigator. So those two other disciplines, sometimes I would say they usually follow the financial assistance pretty closely with different companies. So they might be another resource for you to reach out to. But Audrey is absolutely correct. It's got to come from the patient. When you start asking the questions, it holds the healthcare providers accountable in having to answer the questions.
But in my questioning I belong to the Kaiser Permanente group, and in questioning those folks about financial assistance, they quoted me their assistance program, not the assistance program of the drug manufacturer.
Bob, did you say you're within the Kaiser system?
Yes,
Okay.
Kaiser, yes.
Yep. And I think, sometimes physicians don't even know the cost that the drug is going to be until you've actually left and tried to fill the prescription. And so then you are in that conversation with a pharmacy. So you may be getting your drug through a pharmacy, and that's where that conversation can also take place. But I also hear what you're saying, Bob, in that regard, right? Because Kaiser is their own entity, and they may not be advocating for some of these other programs. So I also want to check back on that for you, Bob. And I'll follow up with Audrey, just so I know specifically within Kaiser what we can do and how we can help advocate and help you advocate within that system. So I will get back to Audrey on that for you too, because it does.
That would be wonderful. Thank you.
It does change that. I agree. And they should still they should still honor you wanting to be part of a nurse program or a nurse support program through the organizations. And I think, we're not unique in the fact that we offer these programs. A lot of pharmaceutical companies offer these, but where I do feel we are unique is we care about every one of you, and we will do everything we can to help you. And so I do really feel that.
Let me just jump in and echo what Brenda just said, because now that you kind of, Bob, what you were saying, I don't know what I don't know. Now that you know about Karyopharms, the next treatment you have, be asking that pharmacy, get in contact the best you can. Use us, Myeloma Crowd by HealthTree, to get in contact with those pharmaceutical companies and say, what do you have for our patients? Because chances are they have a program. So now wait a second, I'm not on my own. Yes, this is astronomical. Revlimid, let's talk about Revlimid. How much is that, But did you know they also have a program? And so let's just work together now that you do know what you didn't know. Let's work together. That's why it's so important to be a part of this Myeloma Crowd community, is we really are advocating for you and helping you advocate for yourself. So hopefully this just helps you learn. This program is amazing by Karyopharm. Now that you know about it, let's take advantage of it. And then other treatments, let's also search for similar programs. So hopefully that helps.
Now I'll be asking that second question. which I didn't know before. So I really appreciate you bringing that up, because of all the lines of treatment I've had, not other than Selinexor was I given access to a patient advocacy group from within the pharmaceutical company. And so now I'll start asking the rest of them.
That's right.
What do you do for your patients besides hand out pills?
Right. And I think I think Kaiser also should be looking at foundation support for you that's available. I know Kaiser has their own foundations.
Yes.
But I think if you are not qualifying for that foundation support, that there are other foundation programs out there. And that's where maybe KaryForward could help wrap around that for you or for anyone else who might end up in that situation with the donut hole or those extra costs within Medicare. So
right, and they just quote their company policy, and I don't qualify from a financial income standpoint, so there's no benefit to me at all.
Okay.
And I understand it. I understand that they didn't set up this program just to benefit Bob Cisneros.
I think that was in there. This is for Bob Cisneros. I thought I read that in there.
I must have missed that paragraph. but now that I know, I'll have a little more ammunition to throw at them.
Yeah. And so so again, for anyone who has commercial insurance, and that again is for someone who's under 65, the copay card program will get the drug down to as little as $5. So if you're not getting it for $5 and you're getting your insurance through your employer, there is that opportunity to go to them and say, hey, this company has a copay card. I'd like to get my drug for as little as $5. Or you go in and print it out yourself and bring it in and say, hey, I would like you to use this for my prescription. Now, our specialty pharmacies should do that too. Yeah, Bob, you had to throw a big wrench in the system because you're the Kaiser person now. So that throws it off a little bit. I'm not even sure Kaiser offers the copay card. So, of course, there's always got to be one.
Yes.
But I agree that for these other organizations too, that is available. Even the SPs, so we have Onco 360 and Biologics, they should also be bringing the drug down to as little as $5. So if you're getting your drug shipped to you from a specialty pharmacy, hopefully they are incorporating that program. So after you leave here today, if you have interest in learning more about our support programs and getting the doctor involved in the program, there's a couple of things that you can do. You can even go in if you wanted to and download and print the enrollment form and bring it into the doctor and say, hey, I would like to sign up for this program. Can you fill out the part of the form that you need to fill out so I can be part of the program? And then you would sign it physically on a piece of paper. Otherwise, the doctor could start the process and they could actually use DocuSign. So many of you might be familiar with DocuSign, where they just shoot you an email and you pick your signature or how you want to do it, and then you sign the document. Again, it's just giving permission for KaryForward to speak with you so that we can have that open dialogue. Or there's also a place on our website that would probably be used by our KaryForward program, which is considered an e-consent or a consent e-form, where you would go in and you would authorize that to be your signature. So there's a couple of different ways that you can move forward if you want to be part of that nurse care program, or if you want to learn more about the support services, or if you even are just like, I don't even know what to do, this is too much, you can call the 1-800 number and they would be able to at least walk you through the process and move you in the right direction. Does anybody else have any questions or comments? I think otherwise that was the majority of what I wanted to share with you today. But I wanted to see if there was any other things that I could address.
So Brenda, I'm not sure if this is the case for XPOVIO, but I have several patients in, I'll just say, the Gulf area that, for example, Revlimid is only offered in certain pharmacies.
Mm-hmm.
I'm not sure if that's the case with XPOVIO, but how can we advocate to the pharmacies, or what's that step that we need to take if I'm having to drive 50 miles in order to pick up my prescription?
So I'll speak first to our program. So our program has 2 SPs that we use. So we're considered a limited specialty network, but we have a more open distribution model than, let's say, Celgene would have. So we have the opportunity that if a pharmacy or office qualifies, they are allowed to dispense XPOVIO. So I feel confident in the fact that you would not have a similar situation as you would have in getting your Revlimid. I cannot speak for Celgene, but I do know that they do have a REMS program. And so that REMS program does limit the way that they do distribute the product. And so that does affect the different places that can or cannot distribute. So we do not have a REMS program, and so that does not limit us. And we, when we brought out XPOVIO, wanted to have more of an open distribution model, so it is more available. I don't know how you can change that, but I think it does go back to what you said. It's all about advocacy, right? It's all about being able to share the voice for the patients and the pharmaceutical company. And I can see Tanya has a comment too.
I'm just curious of why they have to drive the 50 miles and if they can't get the drug shipped, because I know we often ship medications to patients directly. So I would ask if shipping maybe is an option as well.
Okay. Awesome. That was just a question that I wanted to make sure was communicated, even though it's not directly. And I think understanding the differences between, you know, as on our level, we don't really understand that different, or at least me, I'm sure Jenny would, but the REMS program and the other kind of programs that limit availability. So thank you for explaining that. I did want George to know I did see his questions. I think because of the specific personal applications, I'll be talking to George directly. If we have any other questions about XPOVIO or about Selinexor in general, then that's great. If not,
I wonder if, I don't know, Tanya, can you see the chat if you can answer the first question that George has?
Yeah,
clinical question.
I was just going to ask. So yes, so XPOVIO does provide a very rapid, deep, and durable response. And as part of that, it may push you into what we call a stringent complete response, or even deeper into MRD status. So if you are at MRD and you're still on the medication, they may continue the medication up until you get about 2 years of actually that MRD negativity. Once you have 2 years of status, that's when the doctors tend to reevaluate or think about either holding or giving you a treatment-free period at that point in time. We do use the next generation or NGS sequencing to test for the MRD status. We can also use next generation flow as well. So there's a different couple of ways to do that testing, but yes, you can be on XPOVIO during that time period.
Awesome. Thank you. And I've neglected to see that. So thank you for bringing it to my attention.
I also would comment on the second one where it is mentioned that Revlimid is too expensive. I don't know your specific situation or your spouse's, but again, I would go and see if they have any sort of programs that you might be eligible for at Celgene, because I do know that, again, many pharmaceutical companies do offer these types of programs, but they do have different guidelines and rules that they follow. But I would think they would also want to try to work with you to see if you can get your product at a lower cost.
Definitely. Brenda, would you mind sharing or stop?
Sure can.
I don't know how to say that. Stopping sharing.
Stopping sharing.
Yeah, I was going to mention too, we have an incredible resource. Diana Valentine is our myeloma financial coach, and she is a professional financial advisor. She works with Myeloma Crowd by HealthTree to help patients find these kind of patient programs as well. She knows what kind of government grants are available. So her information I'll include in the follow-up email, as well as the information and resources that were shared with us today. Just because she is open and more than willing to help everybody across the board, regardless of income limits, to see what kind of programs are available for them regarding their treatment or their copays or their out-of-pocket costs on clinical trials or whatever it may be. Brenda, I know we did want to talk a little bit about the packets or whatever they're called. I know there's several people here who are on Selinexor or have been, and if there's a way that they can get those packets.
Yeah, so those are the starter kits. And if you've received your drug through a specialty pharmacy, so if it's being shipped to your home from an Onco360 or Biologics, you should have received the starter kit with that first prescription. However, if you're getting your product through a different way, like through a Kaiser or through a health system, you would have to go to your physician and say, I would really like a starter kit from XPOVIO. I was on a myeloma crowd presentation and I was told that they have them. How can you help me get one? And so that is when they should be reaching out to their Karyopharm representative to have those shipped out so that you would be able to get one of those to you. They would be able to get one to you. The pharmacy also, if you are getting your product through a pharmacy within the system or from the doctor's office, should also be able to help you find one of those. If, again, you run into an issue where that is not working, maybe, Audrey, they could reach out to you and we could also help coordinate on the back end.
Yes, absolutely. Just to finish up, Beth, I'm going to put you on the spot. I love Beth. I just want Beth to share a little bit of her story because of the, I'll say, miracle that Selinexor has been for you. And I know a couple people here haven't heard your story, so I'd love if you could just briefly share for those, because I know some people here are not on Selinexor yet, but curious about it. So Beth, would you mind briefly summarizing your miracle story for us?
Sure. Just to let you know the background real short, is I've had myeloma for 23 years. It'll be 24 in November. And I've been on 9 different treatments, including a stem cell transplant and a lot of radiation, about 193 radiation treatments over the years. I have radiation tattoos all over my body. But anyway, but yeah, so I was doing really poorly about a year ago, and I was, my light chain numbers were up to 70. I'd never been up past 15 before, and they were up to 70. I had a large tumor on my sternum. It was a 4-inch by 3-inch by 3-inch tumor on my sternum. And it was just growing, and I was feeling terrible. I couldn't get across the room without having to have assistance. I was being pushed around in a wheelchair, you know, all those kind of things. And the myeloma was just taking a toll on my body, and nothing was working. We did BlendRep, we did Implicity, you know, near that time, and nothing was working for me. And so my oncologist was like, I don't know what we're going to do with you. He's like, but we're running out of things to do. And he said, but I've heard of this combination with dexamethasone and Velcade and Selinexor, and I really want to try it with you. So as soon as it was available, he started me on it. I mean, I think I was like probably one of the first patients in the country to be on it when it came on the market. But anyway, so I went on that, and I, in about a week, my tumor was about half the size. My light chain numbers came down from 70 to 25. And then a week later, you couldn't even tell I had had a tumor. It was completely gone. So in 2 weeks, that tumor was completely gone, and my light chain numbers were down to, I think they were 0.01 or something like that. They were just flatlined at the bottom. And so anyway, and now I just feel so much better. I feel like I have a new lease on life. You know, I'm struggling with a few different things. Still, you know, some dizziness and some fatigue and that kind of stuff. But I'm tolerating the XPOVIO really well. And I just feel like I can go and do things. I was not going out of my house because I couldn't go to the store. I was going to my house and the oncology center, and that was about it. And so anyway, I'm just really thankful for XPOVIO and for everything that it's done for me. So
thank you, Beth. Thank you for sharing that. I just love that because I think sometimes, if I'm being completely honest, XPOVIO kind of gets a bad rap for its side effect profile and just the way that it's been approved, that at first it was just XPOVIO. But I think now that physicians are starting to understand the effectiveness and the dosing, the proper dosing in this first approval of relapse, or you guys know what I'm trying to say, approval at first relapse, that we've been able to see I've personally been able to connect with people and a lot of success stories like Beth. And the exciting part about Selinexor is there's quite a bit of clinical trials right now testing different, not mechanisms, but whatever that word, treatments.
Combination.
Thank you. I'm like, I know it's there. Combinations with Selinexor as well. So I'm really glad that you're here today as a part of our Selinexor support group chapter. It's exciting to learn more together. As Bob said, it is frustrating to not know what we don't know, but that's why that is literally my job as the Myeloma Crowd Community Manager, is to help you learn what we don't know and then do something about it. And also connect with each other and empower each other if we're not alone going through this. So really thankful to you, Brenda and Tanya, for your time. I don't know if you have any last things that you want to say before we go, but thank you for sharing this time with us and for your presentations.
Thank you for the opportunity.
Yes, I just want to say thank you to all of you for joining us and listening to us today. And I hope that, we've given you some information that will be useful for you in your journey, even if it's not with XPOVIO, even with other medications as well. So we continue to support you and we care for you and we wish you all the best.
Thank you. Thank you so much.
Thank
We'll
you.
end with just a couple of announcements as per usual, those who know me. And then we will finish up with our session for today. So we did this already. Our next chapter event is going to be in September. Again, we're doing this every other month now. I think it just works best for chapter members and also makes things more manageable on this end. We're going to be demoing an amazing feature of HealthTree Care Hub called Patient Solutions. So Patient Solutions is basically a program where you look up either a side effect or a treatment. And if you look up a treatment, for example, we're going to be looking up XPOVIO and we're going to see what patients on XPOVIO reported as side effects. And then it doesn't, so if you're curious about, okay, maybe I want to be on XPOVIO, well, these are the side effects that people are experiencing. And then it takes it one step further. What can I do to find solutions for these side effects? And you're able to vote on those side effects. Yes, that worked, or the solutions, excuse me. Yes, that solution worked for that side effect, or kind of worked, or no, it didn't work at all, or made things worse. So I'm excited to have Todd Foster come. He's the head of product here at HealthTree, and he's going to be demoing this patient solutions to you, specifically XPOVIO. What side effects have we seen and what real world solutions have been working for patients with these different solutions? What can we do to alleviate these symptoms? So this is going to be key in improving our side effects and also collecting patient data so that we can better advocate to the doctor's offices, hey, lowering dosing has really worked, or hey, recommend this to your patients because it's really worked for me. That kind of patient advocacy is key. You may be interested in other Myeloma Crowd community events coming up. Today is an exciting day in the Myeloma Crowd community. We have 3 events, and one of them has just concluded. We have 2 more today. At 3 p.m. Eastern, we'll be meeting with international patients, those who are not in the U.S., to talk more about HealthTree Care Hub, what is available for them and what looks a little bit different because they don't reside in the U.S. We have created HealthTree Care Hub to improve and alleviate the burden of the myeloma journey, and also accelerate research so that we can get to a cure. And we can't do it without you, both those outside the US and in. So we're excited to see everyone at 3. And then tonight we have a pretty much a nutrition celebrity joining us.
Yeah.
Dr. Robert Ostfeld is from Forks Over Knives. He's a Forks Over Knives author, and he's going to be joining us to talk to us about how we can have a healthy heart and a healthy lifestyle through plant-based eating. I honestly, when I found out Dr. Robert Ostfeld was coming, I was jumping up and down crazy, and my husband's like, what is wrong with you? And honestly, I told him, I'm like, babe, it's like Dwayne Wade coming to your basketball practice, okay? This is a big deal. So I'm really excited and hope you can join. Everybody and your families and your neighborhoods are invited to that event. That's at 7 p.m. Eastern. Tomorrow is the African American chapter event. We will hear from Black fitness expert Ryan Hurd. She is going to be demonstrating some gentle exercises, and we will also discuss some nutrition tips from experts across the country. Tuesday, August 3rd, we will hear from Diana Valentine. She is our myeloma financial coach, like I mentioned, and she'll be talking about Social Security and what our options are for retirement income. The link to sign up for any of those events and even more events I haven't mentioned today is found at the bottom of this slide and will be sent out in the follow-up email within 48 hours of this event's conclusion. Another thank you to our sponsors, Bristol Myers Squibb, Amgen Oncology, Genentech, Adaptive Biotechnologies, Sanofi Oncopeptides, Karyopharm Therapeutics, Takeda Oncology. And thank you to each of you for helping us build this strong myeloma crowd community. I appreciate each of you and hope that you have a great rest of your day. So thank you so much. We'll see ya.